Welcome to The Explainer. Today, we're totally cracking open the medical reality of major depressive disorder. We are going to look way past the common misconceptions and break down what is actually happening. We'll be looking at everything from its true roots in our biology to the very real, highly effective pathways to recovery.
Okay, let's dive into this. Here is our roadmap for today's explainer. We'll start with beyond normal sadness, move inside the depressed brain, then recognizing the symptoms, making the diagnosis, pathways to recovery, and finally, a future of hope. Section 1. Beyond normal sadness. So, first things first, major depressive disorder, or MDD, is absolutely not a character flaw, and it is definitely not just sadness or a normal reaction to a bad day. It's a serious, tangible medical illness that profoundly and negatively affects how a person feels, thinks, behaves, and functions. It's rooted in some really complex biological and environmental factors, and honestly, it can affect absolutely anyone, regardless of age or background.
We really have to draw a hard line here between a normal emotional reaction and a clinical condition. Look, normal sadness is temporary. It's usually tied to a specific situation, and while it hurts, sometimes a lot, you can still function. Clinical depression, on the other hand, is persistent and severe. The absolute key differentiator here is functional impairment. It actively prevents you from living your daily life, going to work, or maintaining your relationships, and because of that, it requires professional medical treatment.
Section 2. Inside the depressed brain. Is depression just a chemical imbalance? Now, you have definitely heard this before, but we need to bust this myth right now. While brain chemistry is absolutely a factor, the idea that you're just missing one chemical, like serotonin, is a massive oversimplification of a highly complex neurobiological process.
Instead, think of these brain regions as a massive interconnected communication network. The prefrontal cortex, the amygdala, the hippocampus, these are the areas responsible for mood regulation, memory, motivation, emotional processing, and our body's stress response. In depression, the actual physical connectivity and function within this intricate limbic and cognitive network are fundamentally altered. It's like the scaffolding of the brain's communication system is temporarily compromised.
And this brilliantly illustrates that the modern understanding of this disease is that it's a perfect storm of multiple interacting factors. You've got the biological elements, like genetics and neurotransmitters, literally crashing into the psychological ones, like childhood trauma or chronic stress. And all of that interacts with social factors, like isolation or financial distress. True understanding requires a holistic view of the patient's entire life and biology. Section 3. Recognizing the symptoms. People very often think of depression strictly as an emotional state, but it literally physically hijacks the body. We are talking crushing fatigue, significant changes in sleep, whether that means insomnia or sleeping way too much, shifts in appetite and weight, and even psychomotor changes. That means physically slowed thinking or movement. It is very much a full-body experience. Then, of course, we have the severe cognitive and emotional weight of the illness. Beyond persistent sadness, one of the most profound symptoms is anhedonia. That's the complete loss of interest or pleasure in things that once brought joy. Imagine a world where your favorite hobbies, your favorite foods, or even your loved ones evoke absolutely no positive feeling. Combine that with poor concentration, intense guilt, hopelessness, and sometimes thoughts of death. You can really see how deeply this impacts daily function and relationships.
And because of that deep hopelessness, we must talk about suicide risk. If you're a caregiver, a clinician, or just a friend, you have to know the warning signs. These might look like a sudden, unexplained calmness after a period of severe depression, giving away possessions, or deep social withdrawal. If you see these signs, it is non-negotiable. Take them seriously and immediately seek professional psychiatric assessment and emergency support. Never wait.
Section 4. Making the diagnosis. A doctor doesn't just guess here, they follow a rigorous structure. Let's move to and see how this builds into a structured evaluation. They start with a deep medical history and a psychiatric interview. They perform a mental status exam to assess mood, speech, and cognition, and then they use evidence-based rating scales like the PHQ-9 to measure severity. Crucially, they act as detectives, running lab tests like checking thyroid function or vitamin B12 levels to carefully rule out other physical conditions that could just be mimicking depression. Section 5. Pathways to recovery. Psychotherapy is a huge cornerstone of recovery, and we have some incredible evidence-based options today. Cognitive behavioral therapy, or CBT, actively helps patients identify and rewire negative thought patterns and behaviors.
Interpersonal therapy focuses on improving relationships, while acceptance and commitment therapy uses mindfulness strategies. Listen, these aren't just talking, they are highly structured interventions that literally help reshape brain pathways over time. Medication is another crucial pillar for many patients. Remember those complex neurotransmitter networks we looked at earlier? Well, antidepressants like SSRIs, such as sertraline or fluoxetine, or SNRIs, step right in to help regulate that exact system. Now, it's really important to understand that these medications take time to deliver clinical benefits. They require strict adherence, and they must always be managed under close medical supervision. To see how powerful this is, let's look at a real-world scenario. Take a young adult with major depressive disorder. By combining CBT to build mental tools and an SSRI to stabilize the biology, they achieve a remarkable recovery. So the crucial point is that this humanizes the clinical data. It shows us that for many people, a dual, individualized approach of both therapy and medication is the absolute gold standard. But what if the standard treatments aren't quite enough? Well, medicine has advanced incredibly. For treatment-resistant depression, we have highly effective specialized care. This includes things like electroconvulsive therapy, repetitive transcranial magnetic stimulation, and newer ketamine protocols. Plus, there are specialized multidisciplinary approaches for specific vulnerable populations, like mothers experiencing postpartum depression or older adults dealing with late-life depression. The takeaway? There are always further medical options, and there is always hope. Section 6. A future of hope. Now, rehabilitation extends far beyond the doctor's office. Lifestyle modifications are massive pillars for preventing a relapse. Regular exercise literally physically impacts your brain health. Strict sleep hygiene, active stress management, building deep social support, and avoiding alcohol and recreational drugs, these are all actionable, empowering steps that you can take to maintain your recovery and build a resilient foundation. The standard path to remission is a journey for sure. It starts with early recognition and diagnosis, moves to strict adherence to an individualized treatment plan, and results in clinical improvement. But, the journey doesn't stop there. It requires long-term follow-up and relapse prevention. I really want to reassure you that with early intervention and adherence to these medical guidelines, long-term outcomes are highly favorable. I want to deliver this final evidence-aligned message to you today. Depression is a common, highly real, and immensely treatable medical condition. It is not and has never been a sign of weakness. Recovery is absolutely possible. Seeking professional help is a brave, crucial first step toward regaining hope, improving your quality of life, and getting back to the activities you love. Which brings us to our final thought for today. Armed with all this knowledge, how can you foster a supportive, stigma-free environment in your own community to help those seeking recovery? Because while doctors provide the medical treatment, it's the community, the family, and the friends that provide the environment where true healing happens. Thank you so much for joining me on The Explainer today, and keep learning.